Welcome to Quality Time, a Houston Methodist Leading Medicine podcast. I'm your host, Dr. Schaal, a clinician scientist and a retina specialist, and I serve as the Chief Physician Executive of Houston Methodist. Join us each month as my guests and I discuss the many ways that quality impacts care delivery. And today I'm delighted to host here a very esteemed panel of physician leaders. And we're going to talk about physician leadership, professional development, and education. Dr. Carla Braxton, Dr. Lara Colton, and Dr. John Rogg. Let's introduce yourself first. Dr. Braxton, please.
Hi, I'm Dr. Carla Braxton, a Chief Medical Officer and Chief Quality Officer for Houston Methodist West and Houston Methodist Continuing Care Hospitals. I'm a general surgeon and surgical intensivist, and I am the Director of Physician Professional Development for the physician organization at Houston Methodist. Very glad to be here. Thank you for having me.
Fantastic. Dr. Colton.
I'm Dr. Lara Colton. I'm an associate professor of clinical medicine here at Houston Methodist, and I also serve as the designated institutional official overseeing all of our graduate medical education programs.
And Dr. Rogg?
I'm Jonathan Rogg. I'm the Chief Quality Officer at Houston Methodist Hospital and a VP of Operations at Houston Methodist Hospital as well. I also am a clinically active emergency physician.
And you're the director of our new fellowship
HALM
program.
Fellowship. I'm also board certified in HALM as well.
Fantastic. So, Dr. Braxton, you said that you are the Director of Physician Professional Development at Houston Methodist. What does that mean?
So that's a very important new role at Houston Methodist. We physicians have had a long history of leadership in the organization, but not a strong pathway for it. So now with this new role as Director of Physician Professional Development, I get to create and develop programming to support physicians in their leadership journey along the entire spectrum.
So what kind of physician development programs do you have?
So one of the first ones that we've established and we're continuing to grow is our partnership with Rice Business School and our Physician Leadership Development Program. With that, we have a chance to take 25 physicians a year to help grow them in the organizational culture, to help learn strategy, leadership and effectiveness, change management, finance, all the aspects of leadership in healthcare complex environments that they don't normally get to do.
So these are employed physicians at the physician organization, Houston Methodist Physician Organization, and they are selected for this program?
It's a very stringent selection process. These physicians that are chosen for these leadership positions already have titles within the organization. They're chosen by their chairs or by executives within the organization who have not only seen their clinical capability, but have seen their leadership capability and seen their career trajectory. And they want to support that by helping that physician be a stronger leader and more strongly aligned with the organization to create and to support that vision within the organization.
And this is how long is the commitment for this program?
So this program is 6 months long. So it's a full Saturday and a full Friday, once a month for 6 months within the organization, along with the partnership with Rice Business School and the education and the didactics of the various aspects of the business of medicine. They also have the benefit of meeting with executives from Houston Methodist to present those keynote speeches. And then also they do projects so that what they learn in the course is directly applied to an organizational challenge that needs to be solved.
So, Dr. Colton, we heard about one program of physician professional development with collaboration with Rice University, but we have many other training programs for physicians. Tell us a little bit about that.
We do. So graduate medical education has been with Houston Methodist. And in the short 20 years, we have established over 90 graduate medical education programs. We have over 450 residents and fellows, and they are in both our ACGME accredited programs. That's about 2/3 of them. And then another 30 or so are the non-ACGME programs that are overseen and supported by our GMEC, as well as through the non-standard training recognition. These are both core residency programs. So there's 17 that are core residency programs for education that is directly following medical school. And then the vast majority, over 70, in subspecialty training. So those are all the different fellowships. Now, Houston Methodist campus here has the majority of the learners, but in the past 3-4 years, we have now put out into the regional campuses several programs. There's an OBGYN program out at Houston Methodist Willowbrook. There's an internal medicine program and a new transitional year program out at Houston Methodist in the Woodlands. And then our newest program is a family medicine program that will begin in July at Houston Methodist Sugarland. And in addition to that, we have learners that for many years have rotated out to our West Campus and our Baytown campuses. So really a lot of opportunities for education and training for future doctors.
And who are the teachers? Who trains those young residents and fellows?
It's a great question. So we have clinical faculty in all of our departments, here again at the Houston Methodist campus, but also within our regional hospitals. Those are faculty that have, clinical expertise as well as research experience. And so they are responsible for the education, the training, the mentorship of our future doctors.
Fantastic. So these are employed physicians or also employed and non-employed?
Yeah, so both actually. So many of our employed physician organization docs participate and provide educational roles, but we also have physicians that are not in the PO that contribute to the education of our residents, and specifically in programs like radiology or anesthesiology, many of those doctors are not within the physician organization, but they do an outstanding job educating our residents.
Wonderful. And Dr. Rogg, you are now a new appointed director of a fellowship program, a unique fellowship program that is aimed upon for physicians, but physician leaders or physician managers or physician administrators. What is that program? Tell us a little bit about that.
Yeah, so a couple of years ago, the ACGME created a new fellowship, a HALM, which is Healthcare Administration and Leadership Management, recognizing that physicians, in addition to be trained in fellowships such as cardiology or subspecialties of surgery, need to be trained in subspecialties of healthcare administration and management, because physicians really need a place at the table as leaders in our healthcare system. And so this is a new fellowship. There's less than 15 programs in the country. And as I said, I was in the first cohort of physicians nationally to be board certified in HALM.
So HALM is also a new program here, recently approved. Who is the ideal candidate to apply for this program?
Yeah, so young physicians out of training, so either just finishing training or maybe 1 or 2 years out, who have an interest in healthcare administration, who want to become leaders, understand how hospitals and healthcare work, understand what it is to lead large teams to make a difference in our patient lives. That's the type of people that we're looking for.
And not necessarily they need to be employed at Houston Methodist, right? They can come from all over the country?
They can come from anywhere. The only basic requirement is they've completed an ACGME or other approved, other approved fellowship or residency.
So we heard about professional development for employed physicians. We heard about professional development for up-and-coming specialists and, even internal medicine and general medicine. And after that, they subspecialize. And then we hear about this program, which is a little bit unique. So why did we, Houston Methodist, decide to do that? And I guess we're leading the country in that, in very small group of healthcare systems that decided to do that. So why have we decided to do it?
Yeah, I think there's a couple of things that make us a really good place to learn about physician leadership. And the first has nothing to do with physicians. We actually have a strong administrative fellowship programs for non-physicians, for people who have MBAs or MPHs, that has been here since the 70s. And those fellows have gone on to be CEOs of hospitals within our system and nationally as well. So we have a great place and a great experience to start training physicians in those same type of healthcare leadership opportunities. In addition to that, We are a system. So we're not just one hospital. We have an academic hospital, multiple community hospitals, and a physician organization. So if you really want to learn how healthcare leadership happens for physicians, no matter what type of doctor you are, we have a great place. We can train you here to learn that.
And how many fellows are we going to have?
So we're going to have 2 fellows a year, and it's a 2-year fellowship, so it's a total complement of 4 fellows.
Fantastic. So, Dr. Braxton, why is it important to have physician leaders? Why are we investing in so many training programs and opportunities for our physicians to lead?
So physician leadership is vital, especially in complex organizations like Houston Methodist. Physicians need to be great partners with the executives within the organization. They need to be aligned with the goals of the organization. And the only way they can do that is if they learn it and live it. And so how do they do it? So much of what we do is organic. We physician leaders have kind of organically grown into these roles. Now we recognize that physicians do need a little bit more structure when it comes to learning some of this information. Finance, change management, strategy, that's not normally what we learn in residency and fellowship, and we don't need to. We need to become amazing cardiac surgeons, great neurosurgeons. We need to spend our time with those things. But once we take on leadership roles within the organization, we need a little more support and some tools to help us to be great leaders within the organization. And that's where this comes in.
So we talked a little bit about training early on. Now there is a bunch of programs, MD, MBA, MD/MPH, and others that medical students, before they even go to residency training, they complete another degree, maybe in management. How is that different from what we are offering in this HALM fellowship?
Yeah, so that is true. So some learners do come and they've already they've already acquired certain skills. They've already achieved a degree that allows them more skills and experiences with management and with business administration. But those are not skills that they're acquiring necessarily during their residency training here at Houston Methodist. The HALM fellowship program that Dr. Rogg will be overseeing is really geared towards those trainees that have completed their initial clinical training. So they've all done a residency, and it could be emergency medicine or internal medicine or something in the surgical fields, but they have already achieved sort of those clinician milestones. And so what they're doing next is really learning the aspects of the leadership and management at the hospital system level. And it'll be interesting to see, comparing those experiences maybe in the future, and maybe even in the future looking for opportunities for our residents and fellows who want to do an MBA or want to complete an MPH. I've been asked, and we have never really quite had the infrastructure to support or offer those, but it's a great thing to consider.
Yeah, so Dr. Rogg, you've mentioned by yourself that you are a HALM certified physician, but you didn't go through this experience. So tell us how it evolved, what it meant for you, and how this is going to be a little bit different than what you have been doing.
Yeah, well, I didn't go through this experience because there was no ACGME accredited administrative fellowship. I actually did go through an unaccredited fellowship when I was up at MGH in Boston, and then created one at my last institution. So I've seen the evolution of what it is to have and to mentor fellows who are interested in this. Where I think Houston Methodist really has an advantage over some other organizations is the fact that it's so large as a system, and you can learn anything that you want here. If you're interested in more IT-related things or informatics, we have that and you can learn that. If you're interested in more finance-related things, you can learn that. If you're interested in GME, we have that and you can learn from that. So it really gives you a real breadth of opportunity to focus on what part, because administration is not just a monolith. It's not just one thing. It's really many things. And so you can focus on the part that really is important to you while learning enough to be knowledgeable about all aspects of physician leadership.
So we expect these fellows to be actually contributing to the organization, maybe even more than we expect our other learners, right? How do we expect them to be part of this administration or leading the medicine? What do we expect them to do?
Well, I always say whenever you go to teaching adult learners, so fellows, even residents, project-based is really the way to go. And we expect our fellows to be involved in little projects as well as big longitudinal projects that may take a year or more that are going to have significant impact within the organization. And that's really the best way to experience what it means to be a leader, is to be involved in those types of experiences.
And one example, both Dr. Braxton and Dr. Rogg are chief quality officers in our several hospitals in our system. And one of the examples that we saw here is that if we didn't train physician leaders, then for a job like or a role like chief quality officer of a hospital, we'll need to attract people from the outside. So Dr. Braxton, tell us more about our aspirations of training the new chief quality officers from the inside. What are we doing to mitigate that?
Yeah, so, this is really important for us. We have certain critical roles within the organization that we recognize need a deeper bench to pull from. When there's a vacancy or when there's a new opportunity, maybe we've opened a new hospital or we have a new service line, we have opportunities for physicians across this entire organization. Houston is the 4th largest city in the United States. Houston Methodist is across 9 hospitals and spread across this city. There's so much opportunity and we need to capitalize on it. So now we recognize when we've had these vacancies, we've not had physicians already poised to take those roles and to take them over. So we recognize we need to take some steps backwards and start identifying physician leaders who are already going to be great at these positions, start working with them and providing the tutelage and the knowledge base so that they can be strong in their leadership roles, and have them ready to fill these roles as they become available and to help lead within the organization.
So really the vision is to have a quality academy in the future where physicians can be trained to be associate chief quality officers here and in the greater Texas and everywhere else in the country. And tell us a little bit about quality and quality projects within residency and fellowship. That's becoming something that is super important now, right?
It is. It's actually part of requirements through the ACGME. And it's interesting, in the past decade or so, our learners come into residency no matter what specialty they're in, and they expect to be trained in quality and patient safety. And that is not necessarily how we were all trained in the past. And so I think even more important that there's a quality academy. I think residents and fellows have to have some experience with quality data. They have to have experience knowing the basics of, how to file or submit a report if there is a patient safety event. At Houston Methodist, several years ago, we created a really great process whereby residents and fellows are able to attend and participate in the root cause analyses in a way that allows them to just appreciate how the process works and how change can occur. And so my goal for any resident or fellow that graduates from Houston Methodist is that they appreciate what quality is, they understand how Houston Methodist does quality, and that in their future career as a practicing physician, it's part of their day-to-day.
So quality is an emphasis in your programs, how it's going to be emphasized in the HALM Fellowship?
Well, in addition to the rotations that they have with other leaders like CEOs, a big part of the HALM Fellowship will be rotating with the chief quality officers. And I think that's for 2 reasons. The first is to learn about quality and what really makes quality work on a system level, as well as learning the individual natures of things like peer review and individual kind of quality-related issues. But the second part is to get good mentoring. All of our chief quality officers are physicians, and they're some of our strongest physician leaders within the organization. So seeing different physician leaders at different hospitals and how they interact with their CEOs, their physicians, their nurses is a really important part of training good physician leaders.
And one question that I have to ask you is how does all of this, impact the joy in medicine? What do you think?
Well, I think it's two ways. The first way is having physicians involved in leadership roles has a demonstrable impact in improving the quality of life for physicians because they understand the pain points, the good and the bad about being physicians. And so that level of empathy, I think, is really important for leaders anywhere within an organization. And then the second point I'd make about it is having this fellowship as an opportunity for physicians who want more than maybe just a clinical career gives them an avenue. It's not a way out of a clinical career. In fact, we require a clinical practice as part of the fellowship, but it gives you something that you can add on. And one of the things I love is that one day I show up as an ER doctor and the next day I show up as a chief quality officer. That really gives me a lot of joy in what I do.
Wonderful. Dr. Braxton, any thoughts about that?
So I think one of the things that creates joy in medicine for us physician leaders is having some autonomy or some role in the outcome of our environment. And we function in such a complex system as physicians and physician leaders. If you have some capability of impacting your environment in a positive way, you want to do it. You just need to know how. And so the benefit of leader training and developing our leaders is that they can begin to impact large portions of their environment, exercise some autonomy and control, and function within this complex system. And it gives them a lot of satisfaction.
Yes, in our Jimmy Tour, the Joy in Medicine Initiative, we hear again and again physicians say, I want to have a voice. I want to have a voice, but voice and exercising change is two different things. That's what you're trying to do.
Exactly.
Anything about our new generation? I know that people are talking about the differences between the generations and how they appreciate medicine and the commitment to medicine in different ways. Any thoughts about that?
Yeah, I think so. First of all, the joy in medicine is a opportunity for our physician learners to see what the hospital does to ensure the joy, the wellness, sort of the resilience, the things that we need in our attending physicians. And so to be able to role model and to expect that those things will be part of their future career is really critical. Our residents and fellows here also get to experience and see some of the resources that Houston Methodist offers. Not just quality patient care, but opportunities for research, opportunities to learn quality, opportunities like this new fellowship where they can learn leadership skills. There's a program for residents who want to improve and expand their teaching skills. They get a certification to learn how to be better teachers. And so I think all of those things bring joy to our learners.
Wonderful. So last question, similar question to all of you. What does quality mean to you?
Quality to me really means making things better for our patients, for our physicians, and for our other staff. And as long as we do that, I think we have a great future ahead of us.
Wonderful. How about you?
So I'll say that quality in patient care and healthcare has some similarities to quality in education. And so for quality in education, we expect that there's effective teachers, there's faculty mentors, there's a robust curriculum that allows for lifelong learning. There also has to be a safe and supportive and nurturing learning environment in the clinical settings, the operating rooms. There has to be feedback given to our learners. They expect that. And so as long as we're doing those things, I think we'll see very high quality in our education programs.
Wonderful. And Dr. Braxton?
And for me, it's always quality is the right care, the right time, the right patients, the right place. But it's also having the ability to grow continuously. And we now know that physicians want to learn how to lead themselves, lead others, and lead in a complex organization. We can support that, and we can support those outcomes. So I think that that's quality.
Thank you, Dr. Rogg, Dr. Colton, Dr. Braxton, for joining us today. I really appreciate what you do for Houston Methodist, for developing a new fellowship program, for overseeing multiple professional physician development programs, and for teaching our next generation of clinicians that are going to take care of all of us as we age.
Thank you, Dr. Schaal, for spending the time with us, and we're really excited about getting some fellows to work with you and with all of our leaders at Houston Methodist.
Thank you, Dr. Schaal. This was a pleasure, a fun conversation.
And this is definitely our pleasure to share what we plan to do for physician leaders in the future.
Fantastic, and thank you for listening. So that you never miss an episode, subscribe to Quality Time. New episodes will download to your podcast device. I appreciate your support. Thank you, and until next time, I am always listening.